Good afternoon. Thank you for joining this podcast. Today I'm thrilled to join Dr. Alex Towbin, who is Associate Chief of Radiology at Cincinnati Children's Hospital and also the Neil B. Johnson Chair of Informatics at Cincinnati Children's Radiology. Alex is also a recognized, renowned expert in informatics as well as in customer service. And today we'll be talking about his recent manuscript in RadioGraphics on ways in which he can share his information with us about introducing customer service and enhancing it. He's given some wonderful lectures around the world on customer service, and especially both at RSNA and in the ACR quality meetings, and hopefully we can share some of his expertise. So, Alex, thanks for joining us, and I'm going to jump straight in. And You state in your paper that departments of radiology have different customers, and I'm sure in pediatrics it might have even more customers. What would you consider the different customers that you deal with, and perhaps the different stakeholders that are your real challenges that you have to work with?
So I should probably start off. You did a great job of introducing me, and thank you for that. I am a business school flunky. I didn't go to business school is what I mean to say. And so if someone who's gone to business school is probably going to have a deeper understanding and will roll their eyes at the things I'm going to say. But that's my caveat. So I think we have two different types of customers. If you're thinking about it as classes of customers, there are internal customers and external customers. The external customers tend to be the people that we focus on in radiology and a lot of what we do. And those would be our patients and the ordering providers who work with us. They tend to be, so from the ordering provider side, recommend our imaging site for imaging, recommend the test to do, place the request for the imaging procedure. And then the patients are the ones that are getting the imaging study done and that we're trying to take care of. Those are probably the best examples of internal providers. External providers, of external providers. Now I'm all messed up. Example of the internal customers would be people like radiologists, if you're thinking about it from a department administrative standpoint, or the radiology technologists. They are probably our two most important internal customers, trying to do things to improve their job satisfaction because that trickles down to better care for the patients, doing things to help make their jobs easier, to make them more efficient so we can better take care of our patients. See those as really the two main classes, internal and external customers. Mm-hmm. And to figure out who's like our primary customers, or the one, I think that's a bit of a more challenging question. Maybe something we can have more of an argument about.
Yeah, we'll try to avoid an argument for now. I'm wondering, in adult radiology, we're dealing with family members, children. Yeah. I'm wondering, in pediatric radiology, what types of challenges do you experience dealing with children's parents of different ages?
It's a good question. Our external customer of the patient extends to the family, very much so in pediatric radiology. A lot of what we're doing on the imaging side, or everything that we're doing on the imaging side, is to the child. But everything we're doing for preparation, for explanation, for delivering results is to the parent. There are, of course, gray zones in adolescence where we're describing things and talking and sharing results with the patient themselves. We also do treat adults in our hospital and of differing intellectual ability. And so it's always a bit of a mix, but it's involving the family to the best of possible. And so, for example, that can mean if I'm sharing difficult news with the parent, that means I have to, of a young child, I have to do something to help distract that child while we're delivering the news. The parent needs to have the opportunity to process the information, to ask questions related to the information. At the same time, the child can't understand the information that we're providing. If we're, again, talking about a very young child. Mm-hmm. And so we just need a way to help distract them, to engage the child during that time.
And I imagine there's also a lot of challenges with getting consent to do procedures. It can never be easy doing procedures on children, and it must bring a lot of different emotions into play.
It's Yes, it's very true. In the adolescent stages, you want to go for assent as well as getting consent.
Yeah, and I would sort of add that anyone further interested in this topic, obviously, please read this paper. It's a superb paper, and I'm sure Alex is always happy to discuss these issues. And I know Alex will make himself available as a grand round speaker to anyone interested in this topic. Alex, something else you describe in the paper is ServQual.
Yeah.
ServQual, and maybe you could tell us what this is and how it applies to radiology.
So it's interesting if it does apply to radiology. I try to make the argument that it does, or at least the concepts do. But ServQual, so it stands for service quality. It started with research back in the 80s. So in the early 80s, researchers in the retail space and the service industry space tried to figure out how they can best measure what they're doing and the service that they deliver to their customers. And so it's basically measuring perception versus expectations. But through their research, they identified 5 dimensions that contribute significantly to service quality. And so in the business school jargon, there's an acronym called RATER, R-A-T-E-R. And I always have to look it up. So if you see my side glance, that's because I brought my notes. It's reliability, assurance, tangibles, empathy, and responsiveness. And so around those 5 dimensions, then when you think about in the radiology practice, how we deal with those emotions or those qualities, I think there is room for radiology departments and all of medicine in general, radiology departments in specific, to address those components of service quality to provide better care for our patients or better service for our customers.
So practically, if I was starting a program for customer service and I decided to go down this RATER program, how would you implement it? Do you have dashboards? Are you getting metrics and scorecards? What would you tell me or the listeners about starting such a program?
I'm not sure anyone really has a true program on it. Yeah. There are some components that we track, and I'm sure your department tracks as well. For example, responsiveness. That's one that's really tied into a lot of our metrics in radiology. Those can be things like turnaround time, the speed from order being placed to images being performed. That's how good we are at doing our job. Things like assurance can be a lot more difficult. We can measure things like maybe you could assign peer review or peer learning to an assurance step, and how good are we at when we say this is something that's what it is, but they become a lot more difficult to truly dashboard. And something like empathy, I'm not sure it's something you can teach. I'm not sure it's a metric that you can track. Mm-hmm. You may be able to create surrogates for it, like patient experience type scores as a surrogate for empathy, but that's really not what empathy is about. Feeling what the patient feels or helping to understand the caring and attention that we give to our patients. So if I was starting a program up in this, I would look to focus my quality improvement projects and around one of these dimensions, one or maybe 2 of the dimensions, and how can we maximize to those dimensions. So that can be getting feedback from our end users or from our patients, depending on which audience or which customer type you're trying to focus on. And always trying to strive towards some of the qualities in there to maximize towards that.
And how, I just know from reading your work and listening to you, this is obviously your domain of expertise and recognition. How do you get your colleagues to jump on board your bus, so to speak, and follow your example?
It's tying in the things that they're already doing. So in my article, I present a lot of vignettes of things that we did in our department. Many of the things are not things that I was involved with. If you look at when they're referenced as the projects on those papers, I was not involved in the papers. It's celebrating the work that they've already done, right. Showing to them that they are focusing on these things. They don't know it. They've never learned that they are focusing on these dimensions. They really touch on a dimension of service quality and strive towards excellence.
And is there any, to get to part of your business school background, is there any component of customer service in your world that is linked to reimbursement? In other words,
I don't think there is. I'm trying to think. I don't think there is.
Okay, which perhaps is fortunate. I know certain of the organizations that are going more down the ACO world, certainly customer surveys are very, very sort of intricately linked with it. Is there anything about your customer service program that keeps you up at night? Apart from night call.
Yeah. No, nothing that's a real worry to me. I mean, I think we all want to do what's best for our patients. We all want to take good care of patients. We don't always focus on the patients as best we can. You know, I'm going to push you back to the argument you don't want to have about who's our primary customer. I think if we think about what is our end product of what we do, most radiologists will say the report, but then we don't do it. We don't really drive a report to our patients. Mm-hmm. We don't build a report in language that they can understand. We don't give them the tools to help them understand or to break down the jargon.
Right.
There's a lot of room for us to improve as a specialty there, but it doesn't keep me up at night. I think we, as an industry, we have a long way to go, and we're doing a good job of taking baby steps to get there. At some point, we need to do things to rip off the Band-Aid.
Yeah, it's interesting listening to you speak because you're speaking as the quality expert that you are. It's all about taking small steps incrementally, one at a time. It's about approaching, recognizing problems and managing them so you don't have to be kept up at night, which is exactly what you're saying. If I was trying to implement a program in a new institution, are there any lessons I should look out for, any hurdles I should anticipate? I know you've got a pretty mature program.
I mean, as far as hurdles, I think the key is listening. Yeah. It's not thinking that you alone can fix the problem. Mm-hmm. There are lots of people out there, and you need to listen to all of those people. Listening to your frontline staff, listening to your radiologists, listening to your patients, listening to the consultants who are ordering studies and recommending, listening to disappointed or service failures, both from the patient side and the ordering provider side, and how you can do better.
So in your world, you have more than one primary customer?
I believe so. I think we all do. If you're forced to dichotomize, the choices to me are ordering provider and patient. I think the reality is it is a dichotomy. And in a lot of ways, we need to do more for our patients to make them more of a primary customer, to put them on equal footing. Yeah, and most of our improvements in the past have been really directed towards ordering providers, historically in the last 10 or 20 years of our industry.
And also in your world, it's not just primary providers and patient. The patient is a parent. There's a caregiver, a responsible adult, which complicates things even more. I absolutely agree. I think that, as you've written and spoken about numerous times, if you're going to focus on one domain and consider that your customer or stakeholder, you're going to forget about the others. And so you've got to approach our entire spectrum around.
But I think we can shift our focus at times, right? I mean, it is okay to focus on the ordering provider or just for one project, or the patient just for one project.
Agree completely.
And sometimes it iterates. For example, in the last 2 decades, we've focused on PACS from an informatics side, and PACS brought images to the masses when we're talking about ordering providers. Right, we distributed our images and made it easy for them to access. They get reports right away. They're integrated into electronic medical records, and so that's been generational changing for ordering providers. We've not given the same access to our patients. Right, patients can get the images. In the historical days, they could get a film copy. Now we give them a disc. Unfortunately, things like it, that's useless, right? We give them a disk that they can't play on a computer because they don't have a disk drive. Even if they did, it probably is not powered enough to see the images. And so doing things now to focus on better image delivery for our patients from an informatics side of me, that's something we can do, we should do, it's easy. And the only thing stopping us at this point is us, right? Is not saying this is a focus and we should do it.
Right. And you've noticed I've specifically steered away from informatics, which is obviously your big area. But I would say anybody who's interested in this topic, and that really should be everybody, should read Alex's paper on the subject in the upcoming monograph. But also I would recommend you to many of Alex's other papers on the topic. He's written some brilliant articles sharing his expertise with the different domains of customer service. A wonderful, engaging speaker at many meetings, and I've certainly learned a lot from you, and I thank you for your time and congratulate you on this great paper, and I look forward to sharing more of your experiences in the future. So thank you very much.
Well, thank you. I enjoyed the conversation.
Thank you very much.